So meditation, you mean Aum?
1 minute. Yeah. Meditation, different types of meditation. No, the prayer which suits you, the mantra which suits you. You can recite Gayatri Japa 108 times in a month. You can recite Gayatri Japa by inhalation and exhalation. Okay. Inhale and exhale. Inhale and exhale. Gayatri Japa. No normal breathing. No deep breathing. No deep breathing. Why normal breathing? When normal breathing is there, when slow and passive breathing is there, the concentration increases. When you do a deep breathing, the concentration doesn't come to focus. Okay.
Sir, if this question comes in the exam, just like you asked us yesterday, what should the practitioner do first? So, what would be the ideal answer? Should, as per Ashtanga Yoga or as per the current way, like, we start with meditation so that it will calm the mind?
See, these are
Meditation.
the Patanjali Yoga Sutra written in 15th century, 16th century. Okay.
Yeah.
At that time, what the rishis are taught, Yama Nema should be practiced first. The 5 and 10 commandments. 5 of Yama and 5 of Nema. Saucha Santocha Tapaswadya Ishwara Pranidhana. Okay. In those era, people used to practice for years, 2 years. Then only the mind becomes very calm and composed, and then only they can start with the asanas. And better so the asanas result in pranayama. And after pranayama, they do the relaxation. Such are the day-to-day practices. Okay.
Yes.
Now, in irritable bowel syndrome, which are the asanas which why these asanas are taken? And anybody can Parul tell why?
Yes, so that we start first balancing the apana vayu. So that the digestion, the datharagni, everything starts, coming back to normal. It starts balancing.
Why these asanas are taken? Why these standing asanas are taken?
Yeah, I mean that is for the for the apan vayu, to balance, because it is on the abdominal and lower, all the twists that is there, Ardha Chakrasana again, back bend. So it will start activating the digestive fire, the digestive system.
Divya, Divya,
So I was also about to say the same. Since Apana Vayu is located at the bottom, and we need to come on the top so that the what do you say, the nectar is not wasted and the digestive fire is arised. So I also thought the same thing, that up to basically the Apana Vayu to flow. That is why we do the standing poses.
you are all standing pose, which affects the groin area, below the abdomen, below the abdomen. So more
Yeah.
than the intestine and this much. Huh? So the cleansing process at the abdomen, at the duodenum, at the large intestine, small intestine, and the rectum. Which is, see, I am not going forward. Which is the best kriya among the Shaktiya, which
Ye-
is the best kriya for IBS.
Yesterday you had mentioned Shankha Prakshalan. So
Yeah, Shankar.
yesterday you had mentioned that.
Basic.
But is it possible for a patient to do, because
You can start with Shuddhi Kriya. You can start with Jalniti Sutraniti. Okay. Jalniti Sutraniti should do the basic Vaman. Basic Vaman. Basic Vaman not inside the tube. Not Danda Vaman. Not Danda Vaman. Simple lukewarm water with 10 grams of salt. Not iodized salt. Put in a
yeah.
lukewarm water. 1 liter of water, 10 grams of salt. So that the osmotic pressure remains constant.
So I have one query here. Say if the person has got IBS-D diarrhea, like my mom had it. Of course, now by God's grace, she is cured completely with some panchakarma what we had done. But in that case, would Shankha Prakshalan, wouldn't that cause more of
No,
the
no.
diarrhea?
So in that case, it's a contraindication. for some days till the ball set right. Then only you have to do. Shankaprasana is not to be done every month. That is once in 6 months, depending upon the age factor and all. Now,
So, but Shankara Pakshalam, can we do it without a guru? Can we do it by ourselves also?
no, with the teacher only.
With a teacher, yeah.
The teacher only. Because it's a continuous outflow of the feces through the liquid. From the dark yellow, it comes to the solid. The solid goes out. Then the liquid comes. The light yellow comes, and then ultimately the crystal clear water comes. So by 7 or 8 times, the boils become very clear. After that, Shankar Prakshalan, you are supposed to take khichdi with ghee.
Yes.
Why ghee is required? Why khichdi?
So that
The nourishment.
snigdha padartha, what we say, ghee contains that because it creases the intestine. It heals the intestine, you can say. It greases it.
Continuous intake of salt water corrodes the lining of the intestine.
Yes.
Corrodes the lining of the intestine. To make it lubricated, you use the ghee. It should be cow's ghee.
Yes.
Yeah. Okay. Your homemade cow ghee is the best, but in the cities like us, it's not possible to buy it from the store. Whatever it is. Okay. Shall I proceed?
Yes.
Pranayama for IBS, Paschimottanasana, Bhujangasana, Matsyasana, all groin related downward posture. This one. Now pranayama. Kapalbhati, forceful exhalation. Udyan Bandh and Agnisar. Agnisar, you know Agnisar. Flapping of the abdomen.
Yes.
Huh?
Yes.
Put on an empty stomach. Sectional breathing, you know. Breathing one, abdominal breathing, thoracic,
Diaphragmatic breathing and clavicle breathing.
clavicular breathing, and full yogic breathing. Full yogic breathing is to put like this and ये करना. Okay. Yeah. I think my screen is on now. Next comes asthma. Inflated bronchial and patiently nasal spray. This is the position of the lungs. This is the position of the alveoli at the end of this much. Okay. These are the bronchial tubes which are inside. See the alveoli gets corroded here. At the end of the part of the lungs. How do you define asthma? Asthma is a chronic disease involving the airways in the lung. These airways in the bronchial tubes allow the air to come in and out of the lungs. If you have asthma, your airways are always inflamed. They become even more swollen, and the muscles around the airways can tighten when something triggers your symptoms. Now, asthma is a condition which your airways narrow and swell and may produce extra mucus. This can make your breathing difficult and trigger coughing, a whistling sound when you breathe out and shortness of breath. How many types of asthma are there? Nocturnal asthma, exercise-induced asthma, allergic asthma. Nocturnal is the most common type of asthma. Exercise-induced asthma or exercise-induced bronchoconstriction. Physical exertion of the patient during an exercise can trigger the asthma in some cases. Opening up, breathing to the mouth. When a patient is not adjusted to the breathing to the exhalation to the mouth, so there will be a paucity of breath. That will be exercise-induced asthma. Allergic asthma, seasonal asthma, inhaling allergens is the most common trigger for inducing the allergic asthma. Okay, allergic asthma, seasonal asthma, inhaling an allergen is the most common trigger for inducing the allergic asthma. What are the allergic posture? Asthma, if anybody is having asthma, first you start with Kapalbhati and Nadishti Pranayama. Before starting Nadi Shuddhi Pranayama, you should do sectional breathing. Sectional breathing. That is abdominal, thoracic, clavicular, and full yogic breathing. Then go in for the asanas. Why pranayama has to be done here in asthmatic patient or bronchitis?
So that the lungs are working to the full capacity because of that. Like when the diaphragm is open, when the lung is open, and clavicle breathing, it opens up the whole lung. So that helps.
Why Kapalbhati has to be done?
So it exhale when you do Kapalbhati, you exhale carbon dioxide. So because of that, also your body when the carbon dioxide releases, your body gets more better. The lungs will be able to function better.
The intake of the oxygen.
It's even the residual carbon dioxide is expelled out with Kapalbhati.
Yes, that is the answer. Residual carbon dioxide, which otherwise doesn't get expelled out, gets expelled out in Kapalbhati. So your Nadi Shuddhi by default becomes better.
But the patient, I have a query also. So, supposing the patient is not able to breathe properly, say one of the nostril is blocked or something, because even that can happen. Normally, they inhale from the mouth. So, how do we, how will the nadi should be in that case? How can it be done with
the
these?
effect on the Nadi Shuddhi will be much less in that case. When one of the nostril is blocked, the effect on the Nadi Shuddhi will not be to the desired result. It will be to that extent only. Slowly it will be improved over a period of time.
So first, Kapalbhati would be recommended, sir, because that would be more easier for that individual.
Kapalbhati start with 10 strokes or 20 strokes. See the performance. See how the abdominal flapping is going on.
So normally when you have a nose block or when you have that attack, that time you're not supposed to do Anilom Vilom or Nadi Shuddhi. That is what I've heard.
That time you have to do
only a Kapalbhati or other breathing, but not Nadi Shuddhi. When your nose is blocked, especially.
When a nose is blocked, it's a contraindication.
Yeah. I'm asthmatic, so I know much more information.
How many you are telling you are done? You are doing yoga since 5th standard.
5th standard, yeah.
And you are telling like this, you are having asthma. Why? What is the reason?
They are saying it's a genetic condition. My son also has baby asthma. That is what doctors have said that it's I have seasonal. During winters, I get.
Okay. So you have breathing problem.
Only winters. So that time I take care that if I have a nose block or if I'm wheezing, I don't do Anilom Vilom or Nadi Shuddhi. I do others. Kapalbhati, I do.
Okay. You use the trigger, that inhaler.
Yes, I use Acetylene pumps.
When you are doing Kapalbhati, Anulom Vilom, and all for so many years, it should go away, no? Or you are not doing it daily.
So in between, I had stopped. Yeah, correct.
No,
3 years I had stopped.
This is one of your food, madam. You have to do it.
Correct.
No way out.
Correct.
No way out. Acha, coming to Matsyendrasan, Ardha Matsyendrasan, Pawan Muktasan, all chest related. Setu Bandhasan, Bhujangasan, Adho Mukha Shavanasan. Adho Mukha Shavanasan you are done in Surya Namaskar.
Yes. Yes.
Battakonasan, butterfly pose, Purvottanasana, Shavasana. Okay. Methods to keep the lungs healthy: diaphragmatic breathing, simple breathing, counting your breath, watching your posture, staying hydrated, laughing, staying active, joining the breathing club.
So what is a breathing club?
This just I also don't recommend like that breathing club and all.
Because I'm hearing for the first time there's a breathing club.
You heard about laughing club?
Yes.
Yeah.
Yes.
Maybe like that only, but it got no relevance because it has taken the touch.
Okay.
Sinusitis and yogic breathing. What is sinusitis and what is different with sinusitis and asthma?
Sinus is more of the, you can say, the upper respiratory system.
Upper respiratory.
Yeah.
Blockages are
It's
more or less. The blockage is blockage of the nasal tract. The larynx and the pharynx are much more in sinusitis or in asthma.
Mm, nasal part will be more of the sinus. The nasal, yes. Right.
Inside the nerves, they sometimes get enlarged or elongated. That time you have a sinusitis, especially in the nasal part.
Yes. Sinus cavities produce the mucus that nasal passages need to work effectively. Sinusitis can be acute or chronic. Cause of sinus inflammation include viruses, bacteria, fungus, allergies, and an autoimmune reaction. Sinusitis is usually caused by virus and often persists even after the other upper respiratory systems are gone. In some cases, bacteria or rarely fungus may cause a sinus infection. Other conditions such as allergic nasal polyps and tooth infection can also contribute to sinus pain and symptoms. Most sinus infections are viral and only a small proportion develop secondary bacterial infection. Rhinovirus,
Sir, I think I lost the connectivity in between for 5, 10, for 15, 20 seconds. The
huh?
last was I had lost connectivity. I think your frame was frozen. So I missed that last 15, 20 seconds, whatever was.
I'm not able to get you. Tell me again.
I had lost internet connectivity for 15 to 20 seconds. So I'm not sure about what was discussed in the last few seconds.
Okay.
Uh,
Discuss about sinusitis.
okay.
Sinusitis and unique methods of prevention management are the same. What,
Okay.
and I asked what is the difference between the sinusitis and asthma. Sinusitis
How
is more of the nasal congestions which takes place. Okay. The blockage of the nasal tract are much more. Huh? Developing the mucus inside the nasal tract and not allowing the inhalation and exhalation properly. It can be acute or chronic. Cause of sinus include the virus, bacteria, fungus, allergies, and an autoimmune reaction. What are the causes? Any disease symptoms and causes are very much important. Sinus is usually caused by virus and often persist even after the other upper respiratory symptoms are gone. Bacteria or rarely fungus may cause a sinus infection. Other conditions such as allergies, nasal polyps, and tooth infections can also contribute to sinus pains and symptoms. Most sinus infections are viral and only a small portion develops a secondary bacterial infection. Rhinoviruses, influenza viruses, and parainfluenza viruses are the most common cause of sinusitis. What are the causes of sinusitis? Can be caused by an infection, growth in sinus, nasal polyps, swelling of the linings of the your sinuses. Signs and symptoms may include nasal obstruction or congestion that causes difficulty breathing through your nose and pain and swelling around your eyes, cheeks, nose, or forehead. Okay, cause of sinusitis. You have seen this one frontal sinus, ethmoid sinus, sphenoid sinus, and maxillary sinus. These are the bifurcations of the sinus. You can see on the upper part. You can see the anatomical part, frontal sinuses, then you have ethmoid sinuses, and this part, and in between the eyebrows. The nasal cavity, these are the nasal cavity. Then maxillary sinus at the lower part, near the hair of the nose. Then fluid, the hairs which should be always lubricated. But lubrication should not be much. It should have a dropping of the liquid. Okay. Then obstructive sinus and inflammation. Yeah. Next, what are the methods of Jaliti, Kapalbhati, Kapala Randra Dhoti, Sarvangasan, Bhujangasan, Ustrasan, Konasan, Chakrasan. on topsy-turvy postures, mostly on the upper side and the upper part of the lungs. Upper part of the lungs. Okay. Konasana, Chakrasana. Pranayama, Anulom Vilom, Bhastrika, Suryabedhan Pranayama. Remember one thing, we don't have Bhastrika in the examination. We don't have Bhastrika in the examination. We don't have Kumbhak in the examination. Only theory part we are having an Ashtakumbhak. Simple Anulom Vilom, Brahmari, Shitri Shitkari, without Kumbhak. No Bhastrika. Brahmari. Just when I heard about Bhastrika, Bhastrika should not be done any heart patients. Heart patients. There's another disease in respiratory system. Can I tell you what it is? One is asthma, second is sinusitis, third is bronchitis, and fourth is CPOD, chronic pulmonary obstructive disease. Chronic pulmonary obstructive disease. The pulmonary tract which takes from the heart, from the arteries to the lungs, that tract gets infected. So chronic pulmonary obstructive disease. It is not allowing the blood to flow from the upper arteries from the auricle. From the auricle, the blood flows to the lungs through the pulmonary veins and comes back from the lungs to the pulmonary artery. Remember that. Veins carry impure blood, but here it carries the impure blood, goes for purification. The exchange of carbon dioxide and the oxygen takes place at the lungs, and the purified blood comes back to the right auricle. From the right auricle goes to the right ventricle. From the right ventricle goes to the aorta and to the different parts of the body, the purified blood. Okay. Anulom Vilom, Suryabedhan Pranayama. Why Suryabedhan Pranayama is required? Why Suryabedhan?
Create heat in the body so that mucus can start uh, drying up or something. Is that the reason?
Yeah. Hypertension. Very common disease. What is how do you define blood pressure?
Anything above the normal is 120 by 80 systolic diastolic. If it goes beyond like 140, I think recently they have changed. 140/90 is normal. That was passed on, and above that is considered as hypertension.
Hypertension.
I think just about last week we received that 140/90 as being normal.
See, person of my age and all, 70 plus and all, 140/90 will be accepted. So normal person 120/130 by 80 is well enough. Okay. Now, psychological stress management, cardiac scenery, body weight management, healthy dietary pattern, regular physical exercise, regular sleep-wake cycle, reduction in body weight in people with obesity, diet with low sodium potassium, intake with lot of fruits and fibers and vegetables, endurance and resistance training, meditation and relaxation technique. Definition and diagnosis of hypertension. Definition: one of the most common health disorders prevalent today is hypertension or high blood pressure. This occurs when the pressure inside the blood vessel is higher than the normal. Okay. Expected value for age and gender. Yoga, when adopted as a way of life, has a lot of offer to those suffering from the stress-induced psychosomatic lifestyle disorder that is a silent killer. How the diagnosis should be diagnosed only after taking several readings. The blood pressure needs to be taken at least 2 times, and each reading must be different from a different day. What are the practical implications of taking blood pressure? Arun, practical implications. How the blood pressure has to be taken?
There should be 3 readings. One is at when the person is relaxed. when the person, I think they also, when they do that stress test and all in the hospital, they put them on the treadmill and then they check at the max with the endurance, what will the reading come. And the other is on a regular basis. So they take multiple readings and then they will confirm whether it is person is got
You
hypertension.
are talking at a very higher level. Normal person, when he comes back from the office or when he in any stress related this much, the reading will be very high. The blood pressure reading will be very high. So you should be in a relaxed mode. Go to the dispensary, general practitioner dispensary, read something, take a glass of water, relax, and then take the blood pressure. Hurriedly, if he wants to go to the office, and before going to the office, he goes to a doctor. Doctor, to मेरा का BP check करना है. Definitely, it's because his attention is towards bus carrying or train. So naturally, the BP will be high at that time. At that time, though his BP will be normal, at that time, then he feels. And that's why, in the relaxed mode, only the BP has to be taken.
Yes.
Not in a very
Stress mode.
stress mode. Okay. Hypertension 140 by 90 can be diagnosed. A single reading is more than 140 doesn't necessarily confirm hypertension but requires further monitoring. The initial strategy in managing hypertension should always include a dynamic advocacy of lifestyle modifications. However, if patients with BP is on the higher side, medications will need to be taken along with the lifestyle modification until the condition stabilizes. She is not there. I'm not able to see her. Neither my
So
wife.
who saw me? I'm here.
Sir, I just joined. There was some problem. I don't know. My screen froze and then I automatically exited. I have joined again.
Exactly. I think that is the time I thought that mine has frozen. So I asked sir when he came back. I think his was frozen.
Okay.
Mine, this was frozen.
Yes, sir. That is, and I thought my screen had frozen. That's why I asked you that I just got back connectivity. I missed that part in between.
See, one reading has come ki not now, some time back. Your internet is unstable.
Okay. Yes. Yes.
That can be the reason. Anyway, but I see one of your photos. I can see. I mean, now I can see Parul. Okay. General precaution: lose the weight, restrict the alcohol intake, increase the physical activity like walking, etc. Reduce the sodium intake to less than 100 mm. Sodium intake, salt, common salt, NaCl. NaCl BP का दुश्मन है. Sodium chloride. Okay. Common salt. Maintain adequacy of dietary intake of calcium, potassium, and magnesium. Stop smoking and reduce intake of unsaturated fats and cholesterol. What is the yogic management? Involves breathing in circles which can control blood pressure as well as relieve the stress. It will also enhance the functioning of your heart. Yoga leaves a positive impact on your mind and body. It is an effective way to lower the blood pressure. Here are some of it. Balasana, child pose. Controlled breathing while performing this asana promotes calmness and reduction of stress from the neck and the shoulders. Cardio exercises are best for your heart health as they enhance the flow of the blood. This exercise also burn a huge amount of calories and promote a healthy heart.
I had one query here.
Um,
Supposing a patient with hypertension does balancing, the head is down, so won't there be too much flow to the head? They say that we should avoid at that time.
it all
Any kind of
it all depends upon the average reading of the blood pressure which he has since many days. Remember one thing as a yoga teacher, always remember not to stop the blood pressure tablet. Doctor's advice is more prominent than the yoga teacher. Yes, the dosage will come down. Suppose the patient is taking 50 mg. After 6 months of practice and all, it will be 25 mg. Further, after 6 months, it may go to the lowest, it may 5 mg or 10 mg. But 10 mg once a day. Then still further active with this after 1 or 2 years, this can be half tablet also, or this much. Instead of taking 2 tablets, you were taking 10 mg, 1 tablet. So the intake is only 10 mg. provided asanas and pranayama are perfect. This relaxation is there. What is the activity going on? What is the day activity going on? These are all factors are taken into consideration for hypertension. Once in 15 days reading is required to understand where the level of blood pressure is there. What is the level of blood pressure? Okay. These are this. Next is strength and training. Strength training is good for your muscles and bones. It also helps in burning a huge amount of calories. Household chores can also keep you burn the calories. It increases your movement day to day throughout the day. Household activities means भाजी लेके आना, ये सब लेके आना, doing domestic work and all, helping the wife. Okay, climbing the staircase is a clever workout, a smart method to keep yourself fit. Skip the elevator and choose the stairs. When one cannot climb the staircase or get down from the staircase,
So
when
if
the moderate
he is a heart patient, maybe that time.
And
and
even arthritis when the knees, yes.
osteoarthritis. I repeat, osteoarthritis, synovial fluid is there, and age grows, the synovial fluid goes on drying, and there is a friction which is created on the movement of the neck whenever it is bent. That bend occurs usually when you climb the staircase or get down from the staircase. Depends upon where the pain begins. Preferably avoid Padmasana or Ardha Padmasana also, depending on the state of the patient. I'm not able to sit in Padmasana. I'm not able to sit cross leg also. Okay. Accept healthy aging. As age grows, accept the problems. Accept it. Accept it is the best way. It benefits the body in several ways, with specifically focus on your muscles and help you prevent injuries. It basically improves the blood flow to your muscles. Asanas proposed Sukhasana, Shavasana, Cobra posture, Bhujangasana. Cobra pose is helpful for circulating the blood and the oxygen. It pose also reduces stress and promotes the heart rate. Breath posture, Setubandhasana. Calms the brain and elevates. Pranayama, Kapalbhati, Anulom Vilom, Brahmari, full yogic breathing. See, Bhastrika is not done here. Bhastrika is not there. Yoga is the guided meditation as per the standard norms. 8 steps of Yoga Nidra, you know, 8 steps. They'll ask in the examination, read 8 steps of Yoga Nidra. Right now. Viva. We'll take in the practical session. Yoga Nidra 8 steps. Divya is there? Divya?
I'm here.
How do both all the 3 screens should come, no? Why it is not coming?
So you're not able to see my name?
Only one screen is able to see. Okay. Next comes common problem with the youngsters. You can see mobile, which is the next one, neck pain. Common day-to-day problems were driving, motorcycle driving, car,
So even IT professionals, those who have to sit for a long time in front of a screen,
IT professional.
continuously.
And
I had it at one point.
Sorry, Parul.
But it went off. No, I had it. It just went off. I don't know. When I did the next X-ray, it was normal.
This side picture shows the stress on the neck due to the long hours of mobile watching, with stress on the neck with 10 to 12 pounds at 0 angular deviation, 50 pounds with 40 degrees deviation, and 60 pounds with 60 degrees deviation, and home remedies. What is the home remedies? Heating, so that it becomes loosened up. Okay, the stress level. How many vertebrae are there? The neck, Arun,
Next 7. Yesterday you were writing. Yesterday only we had
what is known as medical terminology?
cervical. Cervical.
Then, then,
Then lumbar. Below that will be
no, wrong. Thoracic, 12 thoracic,
thoracic and then lumbar.
5 lumbar, then 9 fused bones. Out of that, 5 are sacrum and 4 is coccyx. Like that, 33 vertebrae. Okay. Cervical spondylitis is a general term for age-related wear and tear affecting the joints of the neck. Also known as cervical osteoarthritis, this condition usually appears in the men and women older than 40 and progressive with the age. Although cervical spondylitis affects both sexes equally, men usually develop it at an earlier age than women. What are the symptoms? Usual signs and symptoms are cervical that brings the patient to the therapist are a stiff, painful neck, shoulder arm or chest pain, numbness, tingling, or prick sensation in the arms, hands, legs, or feet, lack of coordination, difficulty in walking, abdominal reflexes, loss of bladder or power control or urinary bladder dysfunction. Not necessarily pain in the neck. It can be other downward side also. Okay, numbness in the legs, the hands, lack of coordination, difficulty in walking, abdominal reflexes, loss of bladder or bowel control. Also neck pain. Technostress and the accompanying psychophysiological changes due to the modern computer age are important factors in the endopathogenic state, and there is no escaping a computer anywhere, anymore, and anytime. Aging and wear and tear of the spine are major risk factors for spondylitis. The person is more likely to develop spondylitis if they had a previous neck injury. As a yoga teacher, you should advise the patient avoid the neck, no, the neck, what do you call it? That carrier of the neck, making it straight like that. Lot of heat is developed because of that plaster which surround the neck. So,
So also in some postures, you have to lift your head. So that also we should tell them not to do if they have
yeah, yeah.
spondylitis.
But when the normal neck is there, you should always say Jyo Bandha Siya Mudra Brahma Mudra. Jyo Bandha Siya Mudra Brahma Mudra. The specialty of yoga people. Move to the right, come back, inhale, inhalation and exhalation. Jyo Bandha Siya Mudra Brahma Mudra. And when your neck becomes becoming all right and all right, then go in for Bhujangasana. Then going for Bhujangasana. Aging and wear and tear on the spine are major risk factors. But the person is more likely to develop spondylitis if they had a previous neck injury. Specific changes occurring with the age include drying and loss of elasticity in the spinal and cervical disc, bulging and sometimes herniation or disc so that the disc material protrudes from between the two vertebrae, stiffening of the ligaments connecting the neck bones and the muscles. Test and diagnosis, simple movements of the neck with angular rotation on the neck, neurological examination of the neck to be examined with any stress in balancing the movement of the legs and the arms, neck or spinal X-ray, CT scan or magnetic resonance with MRI. CT scan of the spine produces a more detailed image, while the MRI can produce a detailed cross-sectional image of the spine. Okay. Myelogram, this involves generating images using X-rays or CT scan after dye is injected into the spinal canal for better visualization. So, CT scan, X-ray, the hierarchy goes like that. X-ray, CT scan, more deepening into cross-section MRI, and further to that MRI, myelogram. Myelogram is injecting that liquid so that you get a detailed reading, a detailed reading, a cross-section in-depth reading. Okay, so that is the method it goes like that. This is
Sir,
all.
I had doubt over here.
Ah.
If a person who is suffering from this neck pain or spondylitis, isn't it better if the person goes for a yoga therapy instead of just a normal yoga course? Because a therapist or a therapy teacher will be able to give specified postures and asanas or specified kriyas for that. Sorry,
Yeah.
this kumbhak, ashta kumbhak for that pranayama.
Yes. Astakuma pranayama, Jalandhar Vidyarman is not advisable when because we are moving the neck down at Jalandhar. Not advisable in the initial stage till the pain goes away. Once the pain goes away, slowly you can start with Jalandhar in the ratio of 1:1:2. Not to exceed 1:2:2. 1:1:2 is more than sufficient. Purak 1, Kumbhak 1, Rechak 2. Okay.
Okay, sir.
Now, test and diagnosis, simple movement of the neck with angular rotation of the neck. Neurology examination of the neck to be examined with any stress in balancing the movement of the neck. Neck or spinal X-ray, CT scan of magnetic resonance MRI. A CT scan of the spine produces a more detailed image, while the MRI can produce detailed cross-sectional images of the spine. Myelogram we are over. Yogic prevention management of neck. Avoid high impact activities. Neck pain persists. Warm fermentation of the neck region. Add to the warm fermentation. We have got a hot water bag. Rubber bag is there. That can be put or sponging of the hot water. Uh, steam around the neck. Okay. Avoid lifting the weights. Take short breaks while driving, watching, or working on a computer. This is very important for the youngsters. Take a short breaks while driving, watching, and doing. When you are in the office, nowadays all the PCs and computers are there. Work is going on. The neck is like this. Concentration is more on the work, not on the neck. But after some time, then the pain develops. After some hours, 1 hour, 2 hours, you are continuously on any project or any work. So neck is going to strain in. So pain will come. So you have to do best way is not get up from the seat, go to your boss and discuss. So you are on the state level, or go to the washroom, whatever it is, or splash your eyes. Eyes also gets affected due to the internet rays and color rays. Okay. See, these are not so much difficulty for the eyes, but internet rays which are coming that are more difficult. The color rays which are eliminated. For optic nerves, the optic nerves gets affected. Okay. Sushma Vyayam to facilitate the heating energy throughout this one. Vyagra Pranayama with awareness of the movement at the upper back with the breath. Chin Kriya with awareness of the movement at the upper back with the breath. Asanas, standing asanas, Ardhakali Chakrasana, Ardha Chakrasana, Meru Asana, Gomukasana, Mandukasana, Dandasana, Vibhagya Pranayama with special emphasis. Parul is there, na? Parul,
Yes, yes, I'm here.
but both the screens are not visible in screen. And sound for head and neck region. Nadi Siddhya and Damani Pranayama help in reducing the stress level. Kriyas, Janitya and Kunjan Kriya, Mudra, Brahma Mudra for the head and neck region. Relaxation, Shavasana, Yoga Nidra and Ajabajab. See, Yoga Nidra is there.
Is Brahma Mitra?
Brahma Mudra. Mudras. Moving the neck to the right. Left inhale, half of inhale. Look at the back, close your eyes. Open your eyes. Come back, inhale. 3 rounds like this and then go up. Look at upstairs. Come back. This is Brahma Mudra. Okay?
So, what is the
This one
last
that
word in relaxation?
Ajabajab. Continue repeating on Japa.
that Soham, I think, was it that
Soham
same
Japa.
thing?
Gayatri Japam. Gayatri Japam coupled with inhalation and exhalation. half of Gaja, Om Purva South, through inhalation, Virgo Devas Dive, Dio, through exhalation. Normal breathing, no deep breathing while doing the meditation. Relax, relax, relax. Relaxation can only be done, attained. The maximum level of relaxation can be attained only through slower breath. Okay, next, low back pain. Who can get low back pain? Very common condition about who can get continuous car drivers, not executives. Car drivers for whom the car has been driven. Executives they sit for a short time only when they go to the office. Car drivers even when they are at rest also they go on the mobile or this one. Neck is always down and the lower back gets the body is not sitting straight. Okay. Back pain is a very common condition, albeit a uniquely experienced one, ranging from the dull or throbbing feel of the spine, osteoarthritis to shooting, sharp pain of a ruptured disc. Back pain can also come and go, be constant, worsen with exercise or prolonged sitting, and or be associated with neurological symptoms like numbness and tingling. While back pain can be frustrating and debilitating, the upside is that the majority of the episodes in the back pain improve or resolve with the minimal care and usually within a few weeks. Types of disease, lower back, muscle strains and bulging ruptured disc. Muscle strains and sprains are perhaps the most common causes of back pain, especially in the lower back. A strain refers to tearing of a muscle or tendon, while a sprain refers to a tearing of a ligament. With this, tear will result from an injury, like lifting a couch or a graduated orange. Inflammation occurs, causing pain, and in some cases, causing muscle spasm. Bulging ruptured discs. Spinal discs are located between the adjacent vertebra and serve as a shock absorbing cushion. Very distributed at the lower end and the upper end of the vertebra. L4, L5. Between L4 downwards and L5 upwards. Disc is there. And that gives the movement of the vertebral column. The upper end of the vertebra is the bone. The lower end is the slow disc. That is your intravertebral disc. The spinal nerves emanate from the intravertebral disc. Okay?
So slip disc is a common name, na? For the same.
Huh?
This for this slip disc will be the common name. Slip disc.
What
That
is
also
slip
affects
disc? Where it happens? Slip disc. Good question.
in L4 L5 only.
Huh?
L4 L5.
Yeah. Why it happens? Why it doesn't happen in L1, L2? You see the postural condition of a person, driver. How he sits. The bend is toward the L4, L5. It's like this. The L4, L5 is here at the lower part. Okay. It doesn't, no problem takes place at the sacrum and the coccyx region. Why? Why? Usually you don't find any this much.
Because of the posture, the human body posture is such that more stress will come on the lumbar area than the actual.
See, the cushion level and intravenous disc is practically very less at the sacrum and the coccyx region. They are fused bones. They are fused bones. So they are touching each other. Whereas in up to L4, L5, right from C1, C2, it is intravertebral disc is there. What the point? Intravertebral disc is there. And from C1 to C2, T1, T2, T3, up to T12. Huh? Usually you don't get any problem in the middle of this one, spine. Huh? Why it is so? Divya, why it is so? You
So
hardly
because the
hear any
maximum pressure,
problems in the thoracic level. Why?
because maximum pressure is always there at the lower back while sitting, standing, the whatever posture you do when you slope also. The maximum pressure is always on the lower back.
More pressure is created on the lower back. And more so among L5, it is L4, L5. And cervical part, which is the neck problem, it always aggravates.
I think it's C3, C4, if I'm not mistaken,
Correct.
because I had it some time back, but it just went away. I don't know how.
When you are having neck problem, you should not do any neck exercise. You should see the lower part, all the asanas, and slowly your neck will set right. Once your neck set right, that time you can do. Okay. And opening adjacent and serve as a shock absorbing cushions. For a combination of reasons, include the natural causes of aging, trauma to the spine, weight gain, smoking, and repeated stress to the spine. Next, osteoarthritis and sciatica. What is the difference between sciatica and osteoarthritis?
Osteoarthritis, I think, would be osteo means the bone. So it is more of the bone that is involved. And sciatica would be some nerves or in the body.
Divya?
You know, the sciatic nerves go down
Partly you're right,
to the legs.
partly you're right. Divya?
So I also thought that sciatica basically affects the nerve, whereas osteoarthritis affects the bone. That is the major.
Osteoarthritis are nothing but a knee pain. Simple common man language. The medical terminology is osteoarthritis. OA. Doctor always says OA. And there is no solution for it, only a painkiller they give. By which the acidity increases.
So it comes only in knee. Osteoarthritis is only in knee.
This is rheumatic arthritis. Finger joints and all, movement and all. The rheumatism.
Okay.
Deficiency of calcium. Deficiency of usual sodium, potassium, necessary requirement of the minerals are required for the body. And more so for the calcium. Yesterday I again repeat. Highest intake of calcium is ragi. Try to create a habit in your family. Ragi with go. It's it. Sciatica is the biggest nerve in the body, starting from the sacrum till the neck. Sciatica nerve. Which is the asana you remember? Divya? Sciatica. For sciatica. Uttana Padasana. Inhale. Move the leg to 45 degrees. Close eyes. Exhale and come down. Okay. Inhale. Go up. Exhale. Come down. Sciatica or pinching on sciatica nerve, often caused by a hereditary disc or bone spur. Any injury or trauma to the pelvis, buttocks or thighs, diabetes, prolonged sitting, and piriformia syndrome when a small muscle in the buttocks spasms and irritates the sciatica nerve may also cause sciatica. Okay. So sciatica, they'll ask you what is sciatica. So in the Viva they'll ask you. So which is biggest in this month? Sciatica nerve. Start from the sacrum to the leg. Spinal stenosis spondylosis. Spinal stenosis causes back pain in the aging problem. As you get older, the spinal canal gradually becomes constricted or narrowed, due in part in osteoarthritis and the thickening of the tissues in your spine. If the spinal canal becomes too tight, nerve roots may become compressed, causing neurological symptoms like weakness, numbness, and tingling. You can see by this, I'll show you afterwards. I got a BK Iyengar theory I follow on the rope therapy. On the rope. Stretching on the rope and standing in Tadasana. More so on the standing on the toes with 20 to 25, 30 breath. So the calf muscles and the hamstring muscles get tightened up. Thereby your muscles get toned up. Okay. So this also strengthens the partly in the aging process the cervical, which is having scoliosis at present. Okay. Some people don't talk about the disease and all, they feel shy. But as a yoga therapist, I'm supposed to explain what problems I'm having. And I always talk this and how confident you are talking. Yes, I'm confident. I'm a yoga therapist. I'm very much confident in this one. And everybody has to go one day. So I also know one day I have to go. But till that, some problems are there. Accept and healthy aging and solve the problems. After the intake of the medicines, especially neurological medicine, my confidence level is boosted up and the immunity power is boosted up. Okay. Spondylitis before the stress fracture in one of the vertebrae of the spine. This condition can be for anyone at the excluding the last sacrum bones, the fused bones, cervical, thoracic, and lumbar. Okay, not at the fused bones. This condition is most common in children and adolescents who play sports such as gymnastics or football that places repeated stress on the lower back. हाँ फुटबॉल का क्या होता है मैडम फुटबॉल a kick on the big ball what happens there is
Sir, your muscles also can be
there is a
your
stress which
lots
is
of
created at the arthritis level osteoarthritis then there is stress created at the buttocks and the hamstring muscles okay because very fastly you are kicking
yeah, even ligament tear can also happen. That
yes
is also one of the things.
yes
My
okay
son plays football.
gymnastic football that plays repeated stress on the lower back. If a texture weakens the vertebra too much, the vertebra becomes unstable and begin to slip. This contains spondylitis. Symptoms of spondylitis include pain and some stiffness at the site of the slipped vertebra. Osteoporosis, very common with the ladies. Why it is so?
The
So there's a
calcium
calcium
level starts
deficiency.
depleting.
Post menopause stage,
It starts depleting.
depleted. If your parents are taking calcium, let them take, not to stop the calcium. Leafy vegetables, 2 days, 3 days in a week. Avoid spicy. It's good for your children also, for you also. Avoid spicy. Have bajri or jawar chapati. See, I'm doing audit of the bank and Maharashtra State Property Bank. There I get jawar's bakri, jawar's bakri. So I take the opportunity of taking the jawar's bakri. With compressed fracture, person does not report a history of trauma, but rather notes sudden back pain after a simple activity like bending or over or swing. The pain of a vertebral compression fracture is often felt in the lower back or in the middle of the back. Rarely the pain radiates to other areas of the body like the abdomen or legs. Generally speaking, pain from a compression fracture often worsens with motion. Is eased with rest or lying down. Oh, lot of things are there. Still we have got 20 slides. I think we'll have to continue on Monday. Huh? What do you say, Parul?
Okay, sir.
Yes, sir. I think you had mentioned on the group also that till Monday you will be taking class.
Because the slides are more here. Because we are completing that item number 4, 4.1 to 4.20. Okay. So let us go very slow. Any difficulty till now?
Uh, from
1 minute.